Hey everyone, I'm Health 365 facilitator Laura Baldwin, and today I'm going to be talking about the benefits of exercising during pregnancy. Now, historically, women were actually encouraged not to be physically active while they were pregnant in fear of it harming them and their baby. And the reason behind this is that we just didn't have the technology and research back then that we have today to prove this myth otherwise. But now we have mounds of literature that say not only can women be physically active while they're pregnant, but it can actually help with certain things, such as preventing gestational weight gain, it can prevent gestational diabetes, it can help you decrease your low back pain, it can decrease the risk of having urinary incontinence and also developing preeclampsia. It can help you maintain your fitness levels. It's also been shown to prevent and decrease depressive and anxious symptoms, as well as helping you to prevent having any postpartum weight retention. Now, another reason why it's so important to be physically active during this time is because it can help you prepare for the labor and delivery process. Having higher endurance levels will not decrease the pain of childbirth, but what it will do is give you the stamina needed to get through the labor and delivery process easier and possibly even in a shorter time. It's also been shown that this can help you reduce your chance of having a C-section as well. Now, equally important, the benefits of exercising during pregnancy are not only for you, but for your baby as well. It's been shown that babies born of women who are physically active during their pregnancy actually had higher APGAR scores, which is something to indicate the newborn's health. They have been shown to have higher cardiac health and also more advanced motor skills. Some have even suggested that the advanced cardiac health and motor skills can help the baby be a little bit more physically active in their lifetime, which is going to help decrease their chance of having certain chronic diseases. So when you think about it, you're not just helping yourself, you're really helping set your baby up for a very healthy future as well. Now, the exercise recommendations for pregnant women are to get at least 150 minutes of moderate intensity aerobic physical activity, which is any activity that can get your breathing rate up so much that you can still talk, but you can't sing, or 75 minutes of vigorous intensity aerobic exercise, which is going to get your breathing rate up so much that you can barely even say a full sentence. This needs to be done each week over the span of most days, and you can also do resistance training 2 to 3 non-consecutive days per week in addition to the aerobic intensity exercise. Now, as your pregnancy progresses, certain modifications are going to be made, which I will talk about in another video. But it's never too late to start exercising as long as you've been medically cleared. And the reason I say that is because although there are so many benefits of being physically active during this time, there are certain conditions that can make this unsafe for you and your baby. Some of which include having certain heart and lung diseases, having an incompetent cervix or cerclage, being pregnant with twins, triplets, or more, and having risk factors of a preterm labor, having preeclampsia, having severe anemia, or having a preterm labor during the current pregnancy or ruptured membranes. So please make sure you talk with your obstetrician before starting or continuing an exercise routine. And then also, as your pregnancy progresses, your doctor or other members of your healthcare team can monitor it to make sure you're not developing any symptoms that can make exercising unsafe for you. Because if you've been a regular exerciser prior to pregnancy, you can typically do what you've been doing as long as you don't develop any of those symptoms or conditions. Your doctor and your team can also help you know what modifications need to be made as your pregnancy progresses. If you want to know more about the other videos in this series, make sure you click on the link below. I'm Health 365 facilitator Laura Baldwin, and I'll see you next time.